With me now is Simon Calvert from the Christian Institute. Hello, Simon.
Hello.
Now, this is the first time that the government has stressed the importance of biological sex when it comes to same-sex hospital care. Do you welcome those proposals?
Yes. I mean, it's very distressing for people, for women in particular, to find that when they are at their most vulnerable, when they are in situations when they're needing intimate personal care, to find either that they may be exposing themselves to male patients in the same room, or that the medic who's taking care of them is male when they prefer a female. And I mean, this has been a concern for a lot of people for a long time, but their concerns about this issue have been ignored, and quite often they've been demonized even for raising these concerns. Thankfully, we are seeing a return to common sense. This is not to make an accusation that all trans people are somehow a threat to women, and nor is this to say that we don't care about our trans friends and neighbours. Of course, we love them as people, and trans people are entitled to be treated with respect and dignity. But there has been a wholesale reversal of priorities, which has meant that people being treated in hospitals have been subject to these indignities. They have been told, for example, on requesting a female nurse, that a man presenting as a woman really is a woman, and they just have to like it. And so I think an awful lot of people will just breathe a sigh of relief. I think an awful lot of people will wonder how we ever did any different. And again, I would want to be fair and say that, there are trans people who did not want to insist on this wholesale reversal. And that they will be quite content with the changes as well. There are, of course, there will be some trans activists who, react very hostile to these changes. But I'm saying I certainly don't think that they represent the views of the public, and I'm not sure that they even represent the views of the majority of trans people.
And the British Medical Association is against the proposals. They're saying that it's a form of discrimination and it risks limiting patient care. Is there a point to that, do you think?
Well, this is to do with this wholesale reversal. So it's this change, of course, has come off the back of the Cass review into the NHS treatment of children and young people, gender questioning children and young people. And of course, what the Cass review found, and what she exposes in the very ironic way in which she writes, is that all the normal professional standards went out the window. And I would say that was for political reasons. So politics overrode good medicine. It overrode the need for good research. It overrode the need to consider the rights of other people. It was this strange roller coaster that just smashed through all the normal standards. And so it's very disappointing that the BMA in a post-Cass world is still committed, and I would argue for political reasons, not for good medical reasons, is committed to transgender ideology. And I think that I think that things are going to go very badly for organizations like the BMA that refuse to wake up to the reality that that men are men and women are women, and that there is a difference, and that treating trans people with respect does not mean abandoning medical good practice. It does not mean trampling all over the rights of other people. It does not mean abandoning common sense.
And at the moment, trans patients can be treated on communal wards. Is that right? If there's a clinical urgent need?
That's what I understand, yes.
Yeah. And, sorry.
Yeah, and there will be some difficult situations that hospitals have to deal with in the pressure of a hospital environment where sort of decisions are having to be made quickly. But this is evidence that the NHS is having to reorient itself just again to reality to the real world and to the concerns of a wider group of people than merely, activists from Stonewall and others, making demands in the name of trans rights. I mean, I was speaking recently with a clinician who was talking about decisions being made about the administration of anaesthetic to a patient where because the NHS was kind of willfully blinding itself to the real biology of the patient, then actually the patient, the trans patient himself or herself, was at risk of being administered, the drugs in the wrong doses. That just can't be allowed to happen. And again, what Hilary Cass has done is to remind the NHS that actually they need to have a good, solid evidence and research basis for their decisions, and that they need to have regard to the wider implications, and not merely to, as I keep saying, not merely to the demands of Stonewall about trans rights.
And it's obviously it's a shifting story, isn't it? And it would be fair to just to point out that what happens in England and Wales is sometimes different from what happens in Scotland, and it is a changing picture.
Yes.
But under these new proposals, so patients, they'll also have the right to request, as you mentioned, a person of the same biological sex to deliver intimate care. That's a bold statement, isn't it? Is that? Do you think that is a statement that's being made about biological sex?
Isn't it strange that it should? Yes, but isn't it strange that we live in a culture where that should seem like a bold statement? That should seem bold,
yes.
Yes, I mean, and this is the shift. But as I say, what Cass has shown and what I'm arguing is that it's been a political shift, and it's been it hasn't been based on good medicine. It hasn't been based on considering the rights of all the people involved, and I think there's an awful lot of people who used to sort of embrace transgender ideology, and they've seen what it means for women's spaces. They've seen what it means for women's sport. They've seen what it means for what children are being taught in schools. Very confusing ideology being taught to children in schools. And they've seen what it means for gender questioning people themselves. They look at detransitioners and they hear their stories of people saying, in effect, I was mentally very unwell. I had a complex set of reasons why I felt very uncomfortable with my sex. Everyone I spoke to in the NHS and everyone I spoke to online said that transition is the answer. You will experience trans joy, trans euphoria. This will answer all your problems. You will suddenly feel that you fit in. And so they were fast-tracked to, in the case of young women, to double mastectomies and hysterectomies and drugs which have left them with bodies which, just not to get into the details, just don't function properly on all sorts of levels. They're permanent patients requiring ongoing drug treatments, sometimes requiring ongoing surgery to fix what went wrong with the previous surgery. And people hear these stories and they think, what have we done? And throughout the kind of debate on trans issues, I mean, we've been involved in this debate for over 20 years. And throughout the debate, the other side would throw around kind of very sort of emotive, kind of big stick arguments like, if you don't go along with what a trans person says they want, they will commit suicide. I mean, Cass has absolutely demolished that as from an evidence basis. But they would also say quite manipulative arguments that you somehow don't care for a trans person if you don't go along with their demands. But the argument all along, for the 20 years I've been having these discussions, has not been between people who care about trans people and therefore want to give them what they want and people who don't care about trans people. The argument is between two sets of people who care about trans people, but who have a different opinion about the best way of helping those people. And I'm using the term trans. I mean, often what we're talking about is gender confused, gender questioning, gender distressed. It's a very wide category, much wider than the people were diagnosed with genuine gender dysphoria. And even then, the question is over how best to help gender dysphoric people, not one side that cares about them and another side that doesn't.
Yeah, and I think what what I'm hearing from you there is just the importance also of treating the individual as an individual. each person being the same.
Yes.
So, a final question to you, Simon. How can we be praying for people who are perhaps anxious around all of this, struggling with matters of sexuality, gender confusion, and so on? What would you say to that?
Yeah. So I think that it's important when we do talk about these issues that we do recognise the bigger picture. We do recognise the concerns that trans people have. I think it's important that we recognise as well, and I don't know how to say this, but they are being told things about us that are not true. And they are being, caricatures made and misrepresentations. And so we have to be deliberate about trying to kind of unpick those mischaracterizations. And I want to say as well that throughout the course of this debate, and the tide is now receding, there have been many Christians who have been confused by this issue, and many Christians who have gone along with the demands of trans activists, and I think now are realizing that they were wrong to do that. I think now that the tide is subsiding, they realize that was a mistake. And I think it is important that we repent of getting this wrong, of embracing trans ideology rather than, taking a step back, looking at the big picture and looking at the biblical picture and trying to come up with a properly, truth-based Christian position response to these issues. So I think there's room for us to repent of that too. And I think that, trans people and those who love them must know that we love them too. And we must pray for them and that they would feel welcome in our churches.